Fentanyl has hit the U.S. Army, and the hardest is among military branches and has caused a record number of fatal overdoses among our men and women, our soldiers. That's according to a new report by the Washington Post. And the paper is reporting these numbers. 127 soldiers died from fentanyl between 2015 and 2022. That's more than double the number of Army personnel killed in combat in Afghanistan during that same time period. Now, there's a bipartisan group of senators. They've announced a bill to get the armed forces more involved, offer more support. It would compel the Pentagon to make overdose data public each year and improve treatment for military personnel suffering from addiction. To talk more about this with us this morning, Kate Kuzminski is with us. She's a senior fellow and director of the Military Veterans and Society program at the Center for the New American Security. Thank you for being here. Do we fully know the scope of drug abuse in the military, given some of these very alarming numbers we're seeing?
We don't. And the reality is that it's likely underreported, the number of individuals struggling with drug addiction. In part, that's due to the fact that we do want people who have a higher threshold of risk acceptance joining the military. One of the hardest hit installations is Fort Bragg, home of the Special Operations Community. And in part, we do see riskier behavior, and that's something that we're selecting for in these high-risk MOSs, military occupational specialties, but it certainly does raise an alarm to see the numbers out there.
Yep, and there is a stigma across society, we know. Is there also that stigma around drug use in the military, and how does it impact people coming forward looking for support and help?
Yeah, so in the military, the approach is a lot more stringent than it is in society. We've seen a more compassionate approach kind of being levied through civilian society to reduce shame and stigma and have individuals come forward who need help. But the reality is, with respect to military readiness, drug addiction has a major impact, not just on the individual, but on their unit and on their command. And so it's has to be a bit more stringent in the military, and that can create some challenges for individuals coming forward to seek help.
Well, and one of the issues, you know there's a problem, but we don't know how bad it is. Lawmakers have asked the Pentagon publicly to release overdose data each year. Are they doing that? And what more do we need to see from them in terms of transparency with these numbers?
Yeah, it's taken a bit of time for DOD to report the data over to Congress. And I know the Washington Post article also highlighted that there was an undercount that was then corrected later. The bigger issue, I think, is not just the number of individuals who are dying of drug overdoses, but that are experiencing overdoses and surviving over time. So the number that the Washington Post cited was 15,000 individuals between 2017 and 2021 survived an overdose. And that certainly has a readiness impact as well.
Right, which begs the question, why is this happening? What's behind the troubling trend that people are turning to the drug within the ranks, and whether or not they have the support? Do we know one of the reasons why, some factors?
So in part, the military reflects broader society, and so it's just a distillation of what we're seeing writ large. But certainly there are other aspects, such as potentially links between drug use and PTSD based on military service that could be playing a role here as well.
So now that we know some of the why and the troubling numbers that have been revealed in this latest report, what changes immediately might we see? I'm looking at notes that one mother said that there was so much attention paid to her son's burial. She wished the same attention was paid to preventing this from happening in the first place. Might we see some immediate intervention?
There are a couple of things underway that the DOD and the military services could do. One is better training and education, and there's consistent trends between the population who serves in the military and those in colleges and universities. We see a lot of 18 to 21-year-olds, young service members, and so paying attention to the education and training on the preventative front there, and then also making more available naloxone or the other medicines that are able to save someone who has had an overdose, seeing that more widespread across military installations could be a way to reduce the number of deaths due to overdose.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.